what makes treatment effective? Well, in this video, you'll hear from Sarah Fletcher, the Chief Clinical Officer at Sandstone Care, as she explains how you can know that treatment for substance use or mental health conditions is working or has worked. Hey, it's Clint with Sandstone Care, where we help teens, young adults, and their families overcome challenges with substance use, addiction, and mental health conditions. All right, let's get right to it.
I would say that what makes treatment effective is the willingness of everybody involved to recognize that this is a process. There isn't a start and an end to it. And I mentioned a little bit earlier that I would use different modalities depending on what kind of stage of change my client is in. And making treatment effective is no different than that. It takes time and it's not a perfect process. And some days are really, really hard. And then some days are really, really fun and light. And I think my recommendation for anyone who asks me, will this work? I would say you get out of it what you put into it. And so if you are coming to the table completely open and ready to look at the hard stuff and answer really tough questions and go through some heartache, because with substance use and mental health, it is really hard. And being open to understanding that you don't understand sometimes is the most effective tool that you can use. So for me, it's absolutely treatment is effective. And there are so many different layers and levels to the treatment process, depending on that person. We're all completely different human beings. We're all beautifully different, and we have different coping skills and we have different interests. And that's what makes us so amazing, is because we're not the same and we have different interests. And so that really is where I like to start, in that when we come to the table completely open, we're going to go on a really beautiful journey together. And when that journey comes to an end, it doesn't mean that the work is done. It just means that we're ready to do something different. So I know that's a little bit vague. And I wish I could say that this was we start here and in 3 months, everything's going to be fixed. But again, human beings don't get fixed. We're perfectly imperfect and we make mistakes, and all the treatment process can do is help you identify a way to live in a peaceful environment.
I love that you talk about not wanting to think that we're broken, just need to be fixed, right? And at the same time, I want to dig into kind of an element of that openness that you just talked about. So one of the things that Sandstone Care does is we involve the family in the recovery process instead of it just being about the child, so that when the child goes through treatment, and they come back, if nothing's different, sometimes that might be a thing that prevents them from being able to stay sober or stay off of substances. So can you kind of speak to the openness needed by the family and as part of their child's substance use treatment?
Yeah. When it comes to the openness from the family's side of the treatment journey, I always ask families to come to the table prepared to look at themselves. I've had several families come to me and say, I want my son or daughter or my adolescent to stop using drugs and to be happy. And those to me are very hard. They go back to cognitive distortions, right? They're very overgeneralized requests. What I'm interested in is looking at behind the scenes of what got us here. And I know that you mentioned earlier, this is a family process. And again, this is not about blame. This isn't anybody's fault. We all have a hand in the treatment journey. We all shape each other. Every family dynamic is different. And my recommendation to families that come into the treatment process with Sandstone, or frankly with any family therapy community, is that you have to be willing to look at yourself. This isn't about what the other person did wrong or did right. This isn't about pointing fingers. It's about taking your own accountability for your part in the process and then owning your part in the recovery as well. So you get to own what hurt in the past, and then you also get to own how you're going to make this a wonderful experience moving forward.
If you want to learn more about treatment options for you, your teen, or young adult, then tell us about your situation on a confidential call using the number in the description box below, or live chat with us at sandstonecare.com. We'll connect you with the treatment that you need, and if we're not the right fit, we'll get you where you need to go. Be well, and remember that change is possible.